dentinal hypersensitivity is the global oral health problem which affects majority the adult population. Dentinal hypersensitivity alters the quality of life because the pain which lasts because of the dental hypersensitivity causes a frequent and a tangible discomfort to the patients. But before that, I would like to explain how dental hypersensitivity actually occurs. Now for that, when we consider the structure of the tooth, now the tooth has a crown and has a root. The crown of the tooth is covered by a layer called as enamel. Likewise, the root of the tooth is covered by a layer called as cementum. Now these two act as a protective outer layer of the tooth. Beneath these layers, the second layer of the tooth is called as the dentine. Now the specialized structure called dentine is made up of channels or tubules. These are hollow tubules which are called as dentinal tubules. So these are basically a channel which connect the outer surface of the tooth to the inner layer of the tooth, which is the pulp, or which is the nerve of the tooth. Now what happens in the pathology causing dentinal hypersensitivity is when the outer layer of the tooth wears off, either because of the decay or because of the other habits or other etiological factors. These dentinal surface gets exposed and these tubules will carry the stimulus from the outer surface towards inside as a transmittive stimulus towards the nerves and causes a sensation which is called as dentinal hypersensitivity. Now this dentinal hypersensitivity majorly happens because of various reasons. First reason considering is the decay, or called as a dental caries, because of which the enamel wears off or decays or rotten up, because of which the dentine is exposed, or because of the habits which patient can have. Habits could include an improper brushing technique, or maybe using a brush which has got a hard type of bristles or a medium type of bristles, aggressive brushing habits, or using an abrasive toothpaste, a toothpaste which has got lot of abrasive or high micron abrasive particles which will wear off the tooth surface. Second most important thing is patients who have got a habit of clenching, night grinding, which is called as bruxism. It also happens sometimes in swimmers because they are more exposed to chlorinated water, which causes erosion of the tooth. Erosion can also happen in patients who are having a lot or on a habit of having lot of aerated drinks, carbonated drinks, acidic foods, or foodstuff containing lot of vinegar. Even systemically ill patients who have got hiatus problem, who have got gastric aciditis, who have got reflux disease, because of which there will be erosion, and because of this erosion or because of these brushing techniques, the enamel wears off. The second majority reason is the gum disease. In the gum disease, what happens is the gums recede. Now gums are basically covering the root of the tooth, and when the gums recede, the cementum gets exposed, and cementum is weaker than enamel. So it's very easy for the cementum to wear away because of all these things, and when cementum wears away, the root surface gets exposed and then the sensitivity starts. We could say that the higher number of hypersensitivity is in the population with gum disease. 1 out of 7 people have got hypersensitivity, which as per today's calculation, it shows 74% of the population. Maybe the number could be higher, but because the problem is the diagnosis of the hypersensitivity. The diagnosis of dental hypersensitivity is also very important because there are a lot other dental conditions or pathologies which could lead to pain or sensitivity. So the conflicting diagnosis should be clarified, and then once the diagnosis is clear with hypersensitivity, we can look for the management. However, we have got a product which would definitely help you to manage dental hypersensitivity. For more on that, keep watching our videos.